The Community Health Partnership strongly supports Supervisor Chavez and Supervisor Lee's proposal to establish a health and wellness service center to increase health access for families and communities that have been deeply impacted by social determinants of health. Social determinants of health are examples: poverty, lack of formal education, poor access or no access to healthy food, lack of green space, safe neighborhoods, areas where your children can play, racism, and other factors that contribute to health inequities, unfortunately, ultimately result in extremely poor health. And I do use the word extremely because we're off the charts in our data. One of the examples is chronic disease, particularly diabetes. We're also seeing data now that is showing us that there's a strong connection to isolation, lack of civic engagement, and mental health. The data is overwhelming. In the next few weeks, the Latino Civic Engagement Report will be available, followed by the Latino Health Assessment. Studies which will confirm that unjust policies, practices, greed, and racism have played major roles in today's health outcomes of many, many populations, especially those marginalized communities such as ours. I would like to publicly commend and thank Supervisor Chavez and Supervisor Lee for acknowledging that we have a moral obligation to address the historic injustices and ongoing health equities that our gente, our people, are experiencing, and really everyone that's marginalized. We appreciate and applaud the fact that there will be a community engagement process that will inform and design the type of services that will be provided at the Latinx Health and Wellness Center. That name will probably change, but for now we'll use that. By providing a place where social activity can happen, resources, health education, and civic participation come together to provide a comprehensive approach to health and, more importantly, to healing. The County of Santa Clara and its partners, like the community clinics, can more successfully serve the health and social needs of San Jose. So with that, I close my comments, and I would like to ask Mr. Saul Ramos, co-director of Somos Mayfair, to take the podium.
Good morning. My name is Saul Ramos, co-executive director at Somos Mayfair, along with Victor Vasquez, and a member of the Si Se Puede Collective. And I'm here to echo what is an ongoing reality for the east side of San Jose. A prolonged struggle to access culturally competent and language-accessible health services. The east side community has emerged from the COVID-19 pandemic, battling not only exacerbated displacement or economic injustice, but really disproportionate health disparities amplified for our Latinas, our Latinos, our youth, and our Spanish-speaking community. And yet, through these struggles, the county has shown us that it can respond and embrace the complexities of disinvested communities. Working collectively with neighbors, nonprofits, and families, they have really thought about a fully integrated model. As an example of that, we have our Vietnamese American Service Center, a beautiful space that delivers culturally responsive supports and service of our Vietnamese brothers and sisters. So I'm thankful for Supervisor Chavez and Supervisor Lee for elevating learned lessons from previous community-led projects and calling for the creation of a Latinx health and wellness in the east side of San Jose. And yes, probably a different name. It is time. It is time. I am thankful for the leadership of Supervisor Arenas and her urgent vision to call for Latino health assessment, in which organizations like Somos Mayfair and many of the organizations who are here continue to elevate the unique perspective and needs of the Latinx community and legitimize a claim for unique service model and facility in this county. It is time. It has been time for the promotoras and organizers who door knocked throughout the pandemic and still today are hearing about ongoing barriers to access services for our youth and children as school districts continue to elevate the mental health issues and support for navigation of resources and services. And those are the key challenges for the student and well-being support system, for a community that has witnessed the dismantling of historic infrastructures like MAXA to support the well-being and leadership development of our communities, our families, our youth, and children. We must bring these resources back. It is time. We look forward to the leadership of Supervisor Arenas, Chavez, Lee, guided by community, to lead with innovation and intentionality in addressing the chronic health disparities impacting our county. And as a place-based organization with deep roots in Mayfair, we ask our county supervisors to accept the moral obligation of the county to address ongoing disparities and accept the recommendation for a new Latinx Health and Wellness Center. We want them to engage with the people of the East Side for the development of the center, tapping in this generational expertise that is rooted in pragmatic cycle of learning, thoughtful implementation, and ongoing reflection. We have an opportunity for community making, centering the well-being of generations of families to come for a vision that we all can be proud of. Thank you so much. And now I would like to introduce Julia Barba, Director of Community Programs, and Every Woman Counts. Julia.
Thank you, Saul. Good morning, everyone. My name is Julia Barba, Director of Community Programs and the EWC Every Woman Counts program at Community Health Partnership. Today is the day that we will affirmatively demand that a Latinx Health and Wellness Center be established in Santa Clara County. When I imagine a Latinx Health and Wellness Center, I think about the patients that we serve, who need and deserve more accessible, culturally proficient health and wellness services. A place that embraces our Latinx community, where there's a sense of belonging. A wellness center that uses Spanish and Chicano language, Latino culture, and recognizes these as strengths and assets, not barriers to improving health outcomes for families, individuals, and our whole community. Are we ready?
Ready!
Are we ready? Yes! In Santa Clara County, Latinos have the highest uninsured rate and the highest rate of prediabetes. Along with African ancestry and male residents have the highest rates of diabetes-related deaths. Latinas have a higher incident rate of late-stage breast cancer diagnosis than the county-wide incident rate. And Latinas have the highest incident rate for late-stage cervical cancer diagnosis. A physical space, such as the Latinx Health and Wellness Center, will be able to work towards improvement of these and more health disparities our Latinx communities are experiencing. The Latinx Health and Wellness Center will provide wellness services that facilitate social connectedness and provide health education programming backed by research and evaluation to show improvement of health outcomes in Latinx communities. A dedicated Latinx Health and Wellness Center will be able to complement primary care services that patients receive at health centers, clinics, and hospitals by providing residents with the knowledge, skills, and accessible resources to live healthier lives and improve prevention and management of chronic conditions and health issues impacting our Latinx community. In our work at Community Health Partnership, we provide health education and navigation services for over 1,000 community members annually who need access to breast and cervical cancer screening. And because our team members are bilingual and bicultural, we're able to address the difficulties Spanish-speaking community members experience, such as identifying and finding staff who can speak your language, health and wellness services that don't relate to your culture or understand your lived experience, and having to navigate complex systems to access basic health and wellness needs. A Latinx Health and Wellness Center will be able to complement all the services that are being provided in our county and really push forward to addressing deep-rooted disparities in our community. Health and wellness services should be accessible for all. In closing, I'd like to say thank you to Supervisor Chavez and Supervisor Otter Lee for bringing forth this referral and establish the Latinx Health and Wellness Center today. Thank you. Woo. And next to speak, I would like to introduce Carmen Gonzalez, patient advocate and board member of Gardner Health Services.
Go Carmen!
Buenos días, mi nombre es Carmen González, soy miembro de la mesa directiva como un paciente de las clínicas Gardner. Por su servicio y siglas en inglés es Gardner Health Services. Cindy Chávez, como supervisora del condado de Santa Clara, junto con el supervisor Otolí, le están remitiendo a la administración del condado una propuesta de fundar un Centro de Servicios de Salud y Bienestar Latinx. Como miembro de la mesa directiva y como paciente de las clínicas Garner, he vivido y experimentado el impacto de la atención médica, los servicios y los recursos que ejercen en la calidad de vida de los residentes de la zona este de San José. Como miembro de la comunidad de habla hispana, aprecio el enfoque cultural apropiado y la atención en el idioma que me proporciona Garner para los servicios de mi salud y bienestar. Este enfoque centrado en la comunidad nos ha permitido a muchas personas mejorar nuestra salud de una forma que resulta natural. Solamente para el beneficio de los pacientes de la clínica Garner sería un gran avance para todos los residentes e impulsaría hacia adelante la equidad y el cuidado de la salud para nuestra comunidad. Tener un centro de servicio de salud y bienestar Latinx proporcionaría como mejores recursos para la comunidad entera, jóvenes y adultos, para mejorar nuestra salud, nuestro bienestar y la calidad de vida. Por experiencia propia, sé que de no existir el compromiso de las clínicas Garner que brindan atención en mi propio idioma y a mi familia, no tendríamos el éxito con respecto a nuestra salud. Le pido al condado, a la mesa directiva del condado que apoye el Centro de Servicios y Bienestar Latinx e insto a la comunidad para apoyar estas instalaciones de importante y crítica necesidad en la zona este de la ciudad de San José. Gracias.
Thank you.
Good morning, everyone. My name is Vaughn Villaverde, and I'm the Director of Advocacy at ACI, Asian Americans for Community Involvement. I'm here today to express our enthusiastic support for the proposed Latinx Health and Wellness Resource Center introduced by Supervisors Chavez and Lee. East San Jose is a vibrant community that stands as a rich example of the multiculturalism that is Silicon Valley. But it's no secret that this community continues to face social determinants of health that has led to persistent health disparities compared with the rest of the county. ACI has had a presence in East San Jose for years, providing primary care, dental, behavioral health, and wellness services. In the coming months and years, we plan on greatly expanding this presence in this community because we understand that not only is the need great and growing, but that it'll take all of us, local government, community-based organizations, and the private sector to solve this ongoing challenge. We strongly support the county establishing a Latinx Health and Wellness Resource Center, and it is a mouthful, Dolores, to complement the work of our community health centers, both as another entry point for residents to access resources, services, and information that's to address these social determinants of health, but also as another thread to the region's healthcare safety net. As a community health center with a proud history of serving immigrants, refugees, and communities of color, ACI is also committed to providing inclusive and culturally sensitive services. Our staff speak over 40 languages and dialects. We have seen firsthand the value and impact of having a doctor that understands your language and who understands the culture you're coming from. We believe that every resident in every community deserves this level of care and compassion from their providers. And we are eager to see the positive impact the Latinx Health and Wellness Resource Center will have on the health of our Latinx communities. ACI is also an organization that has historically served Asian and Asian American communities in the region. But having been founded in 1973 on bedrock principles of equity, inclusion, and social justice, we felt it important to show up and stand in solidarity along with our Latinx friends and neighbors. We strongly believe the Latinx Health and Wellness Resource Center could be a critical step in increasing access to culturally responsive care, bilingual support services, and resources tailored to the Latinx community's specific needs. We encourage all members of our diverse communities to support this project, and we urge the Santa Clara County Board of Supervisors to move quickly and make this dream a reality. Thank you.
Thank you very much. Is the volume okay? Or yes. Yeah. Is it me? Yeah. Give me a second here. Before we close, I want to acknowledge two people that are in our audience. That is Nora Campos and Raimundo Espinosa. And let tell you why I'd like to acknowledge them. First of all, to thank them for being here. Secondly, they worked with, as a team, the three of us plus two other folks, Isabel Duron and Elizabeth Alvarez, we engaged in a research project that connects lack of civic engagement with poor health. That's why this project that we're going to roll out, this is the beginning. And when Supervisor Chavez went to the first meeting to see the outcome of their presentation, that's how this started to formulate in her head, which is a lot in there. So I want to thank you, Nora. I want to thank you, Raymundo. This is an it makes me cry. It makes me cry. So thank you. I'm going to close by thanking our speakers and attendees for joining Community Health Partnership in support of the Latinx Health and Wellness Center. This afternoon at 1:30, the board will start the deliberation or presentation about what the center, if the center is going to be created, where the funding is going to come from, etc. I encourage all of you to attend the hearing in person or via Zoom so that you can express your support of Supervisor Chavez and Supervisor Lee's referral, good intention, and really a very strategic and smart way of developing something based on data at a time where there could be some funding in the capital bucket. It's a timely area for that, as my friend Saul said. The other thing I would like you to let you know about, and Saul mentioned it, is Supervisor Arenas has started a project called the Latino Health Assessment. It's a very deep and tedious project which will have great information about what we really look like in this county from a health perspective, all the way from Palo Alto to Gilroy. So that is focused on the entire population because it'll be compared. What does the Latino data look like compared to perhaps another richer community, etc. So please be aware of that, and you can call me, you can call Saul. Who else is on the committee? Darcy Green is there. You can call one of us for more information, and we will invite you to join in and listen. Creating a health and wellness resource center in East San Jose to serve our Spanish-speaking community and others, because we know it's diverse, is long overdue. Addressing community health linguistically and culturally will move our county towards improved health equity and healthy families. The need is great, and the time is now. So thank you again for being here.